Thank you, and thank you for the opportunity to present my work in the retreat this year. So we heard a great talk from my colleague Georgios before about the potential applications of corneal confocal microscopy in dementia, but I'm going to focus on a different area, that of multiple sclerosis. So the problem in multiple sclerosis is that patients over time develop inflammatory events, which are called relapses, which eventually lead to the formation of new lesions, and that results in advanced disability. So the thinking about the process before was that inflammation occurring in the early stages actually leads to neurodegeneration, which then results into progressive disease. But what has become apparent is that this whole process is facilitated by axonal loss. So a lot of studies taking place in the last 15-20 years have shown that axonal loss is the main determinant of disease progression, and they have highlighted the problem with current clinical scales and MRIs because they cannot directly capture axonal loss. And this is a problem in the wider neurology landscape. So better biomarkers are needed to monitor disease activity, stratify patients, and assess therapeutic benefit. And in terms of multiple sclerosis in Qatar, there is medium to high prevalence, surprisingly in Qatar, which is the highest in the region. And in terms of clinical characteristics, there's more female patients than males. Relapsing remitting multiple sclerosis, the milder form, is the one that is more prevalent in Qatar. And most patients present with sensory abnormalities and optic neuritis. So optic neuritis is a key inflammatory event in multiple sclerosis. So what we've done a study here in Qatar to understand the role of corneal confocal microscopy as an endpoint of axonal loss. And what you see there is an image from a healthy control. Anyway, these right there. Nerve fibers and nerve branches are abandoned in the image. And these are images from a patient with relapsing remitting multiple sclerosis, the milder form, where there is already significant loss of nerve fibers, and then moving to a patient with progressive multiple sclerosis, where there's more advanced loss of nerve fibers. And the clinical scores, EDSS of 0 indicates no abnormalities in relation to multiple sclerosis at that stage, and EDSS of 6 is actually quite advanced. And this is the analysis that we performed. You've seen that from Georgios. I'm not going to stay on that. So we measure fiber density, length, branches, and fractals as an indication of geometric complexity in the image, just to understand the pathology that is taking place. And these are the results from the pilot phase of the study. And what we saw there is that in patients with multiple sclerosis, compared to age-matched controls, there is a significant reduction in fiber density, branch density, fiber length. Looking at the individual data, which is important, we're not saying that all the patients have the feature of nerve loss, but a subgroup of these patients, who are the high-risk patients, develop this pattern of axonal loss. And that happens for all parameters, fiber density, length, and branches. So this change was not related to the stage of multiple sclerosis, so any patient could have it, whether early or progressive. It was not related to optic neuritis, and it was related to the clinical disability of these patients. So we now have a 2-year study here in Qatar. These are the baseline results. The study has around 90 patients, and we have patients with clinically isolated syndrome, which is a predecessor to multiple sclerosis, relapsing remitting multiple sclerosis, and secondary progressive multiple sclerosis. And what we see there is that in the group as a whole, which you see here in gray, there is the same significant reduction that we see compared to controls, but this occurs as early as clinically isolated syndrome, and that progresses throughout. And we see that again for fibers, we see that for length, we see that for fractals. And this is what it looks like on CCM, again a control image, and these are images from patients, clinically isolated syndrome, and then the more advanced stages of the disease. And here's a preview of the follow-up data. So we've seen about 50 patients so far. We don't see any change in the clinical scales. We don't see a significant change in fiber density, although there is a little bit of a reduction. And we see, to our surprise, an increase in the number of branches, which is significant, length, and fractals. So we're really puzzled with this, and how can we interpret that? So what we did was to split the patients based on their individual characteristics. And this is what we found. So what you see here is fiber density, and you see patients who show a significant decline in the amount of fibers. This is losing more than 1 fiber per year. So this is about 46% of the patients. Then there is a group of patients which is actually stable and is about 18%, and a group of patients who significantly improve during the same time. Now, if you look at the branches, which we know they're very important because they're very sensitive to change, for the same patients who actually lose fibers, branches increase, and then there is a stronger signal in those who are stable, and even stronger signal in those who improve. So we thought that these patients are actually on disease-modified treatments, which are quite powerful. And we wanted at first to understand what is happening with their treatments. And what we see is that in the patients who actually continue to lose fibers, 52% discontinue from the medications, or they switch multiple medications and then discontinue, which is devastating, actually. So in the group which is stable, 22% of patients discontinue, and then only 6% in those who improve, suggesting that there is possibly a link between the ongoing process of axonal loss and medication effects in these patients. So we're now conducting the MRI part of the study to understand what is happening in the brains of these patients, and we have about 30 patients to bring back for follow-up, so hopefully I'll be able to share more results. And to conclude, in terms of future work, there's still a lot of work to be done. So we're trying to understand the events that take place before coronary nerve loss, such as accumulation of inflammatory cells that we know interact with the nerves, and understand what is their contribution exactly. There is a lot of studies suggesting that coronary nerves are involved in different disease areas. So we're trying to understand about the specificity of these findings. We've shown that there is a different pattern of loss between peripheral neuropathies, and now we want to extend that to central neuropathies as well. We want to understand the molecular events that take place and lead to coronary nerve loss. Of course, we want to compare brain pathology with coronary nerve pathology and see what are the links there. We're developing a algorithm based on deep learning in collaboration with Qatar University to streamline the analysis process. And of course, we would like longer-term follow-up, and why not clinical trials? And on this note, thank you very much for your attention and for your time.